Hi everyone, it's Dr. Loniewski from the Living Well for Life Center. Today we're going to talk about a condition that's a real pain in the neck, referred to as a pinched nerve. Pinched nerves can occur in different parts of the body. If it occurs in the wrist, it's referred to as carpal tunnel. If it happens in the lower part of the back, it's referred to as sciatica. But neck pain and pinched nerves occur in 1 out of every 10 Americans. It's most common between the ages of 18 and 64. And there's actually 13.2 million visits to the doctor or hospital for a pinched nerve. Now what a pinched nerve is, at least into the neck, it can cause pain, cause numbness and tingling down the arms, numbness or even weakness. There are 3 common causes of pinched nerves. One could be a herniated disc or a slipped disc. Second could be arthritis. But the third most common cause is referred to as a subluxation. Now, what a subluxation is, if I was to take these bones out of the spine, it basically should be nice and straight. But what a pinched nerve looks like and a subluxation looks like is this. One of the most important things in treating a pinched nerve is diagnosing it properly. We do something here what's called a motion study. It will tell me if it's from a herniated disc, arthritis, or from a subluxation. All 3 approaches are treatable through chiropractic care. But the medical approach to problems like this would be maybe a painkiller, muscle relaxers, anti-inflammatories. But a muscle relaxer can't make that bone go back to middle. This is a structural problem that needs a structural solution. Other things that have been tried medically wise, steroid injections. These things also can't move that bone back to proper alignment, but can actually cause a problem known as osteoporosis. Another approach is surgery, but as we know, back surgery is 74% unsuccessful rate, failure rate. So our approach here, what I want to do is show you at least 2 or 3 things you can do at home, and I'll tell you what we can do here in the office to help with the pinched nerve. What I want to do is I want to show you a common stretch, but first thing when you have a pinched nerve, you want to use cold or ice pack. Don't put heat on it. When there is pain, there's usually inflammation, and inflammation is pain. So if you put heat on top of heat, it's like putting gas on a fire. So if you put ice on it, maybe for about 15 to 20 minutes, a few times during the day. Now, I want to show you a stretch that you can do called an anchor stretch. So what I want you to do is I'm going to have the patient stand up for me. Very simple stretch. What we're going to do is we're going to stretch out the muscles over here. So I'm going to have you just go ahead and let your ear drop to the shoulder. And that's all. And it'll stay there for at least 20 seconds. There's no pulling on the head, nothing aggressive. You just want to get the body to say maybe stretch that muscle out without being too aggressive. Go ahead and bring your head back to the middle. There's another exercise called the shoulder shrug. Now there are 3 parts to this exercise. What I'm going to have you do is turn your body this way for me. It's a shrug. So what I want you to do is you're going to bring your shoulders up to your ears, back to your shoulders, and all the way down. Now keep your head nice and straight. So we're going to bring the shoulders up, back, and then down. That's something you can do maybe 10 repetitions, 2 or 3 times a day. Now in the office, what we do here is we have a very unique approach to treating this. One, when diagnosed properly, we can perform specific chiropractic adjustments. Very extremely relaxing, probably the most relaxing thing people do in the course of a day. We have a functional therapy center, which we use ultrasound, electric muscle stimulation, intersegmental traction. We also have our own functional fitness center that we do functional rehab, very specific protocols to help someone not only feel better, but to actually fix the problem that they have. And there's something else that we use in the office called a Denerol. This is a custom orthotic based on x-rays that's used for the neck. Orthotics used for the feet. This orthotic is used for the arc of life, which is the arc of the neck. If this information is of interest to you, please like us below, send us a message. If you know someone who has this condition or like to be evaluated, tag them in this. But if you have questions, you want to come in to schedule a consultation, give us a call, 908-431-7700. Give us a call. We'll see if we can help you out. Have a great day.